America strong.
In the 20th century, William Shatner took us on a voyage to other planets and to other ways of life. And now, here in the 21st century, we're back on our own planet to explore new technologies and lifestyles that affect those of us who live here on Earth. It's all a part of a series that we call Keeping America Strong. And today, we are going to look at something very special. And it involves keeping Americans healthy, especially looking healthier. And in this day and age, when Americans are living longer than ever before and are working in the workforce longer than ever before, it really is more important than ever for them to look vital, to look younger, because it does pay dividends, as you're about to find out. Our guest is Dr. Jon Mendelsohn. He is the medical director of the Advanced Cosmetic Surgery and Laser Center in Cincinnati, Ohio. Doctor, nice to have you with us. Welcome aboard.
Nice to be here. Thank you.
Let me ask you just point blank, why is it so important now for people to look vital, energized, younger, if to use a different word?
Well, as you mentioned, people in the United States do live longer, they take better care of themselves, they live healthier lives, and they're trying to compete in the workforce with younger individuals often. And I think building self-esteem and self-confidence through cosmetic surgery is one of the ways that people feel better about themselves.
And it does make a difference in getting jobs, doesn't it?
I think it does.
Especially for men.
Yes.
And I presume it probably would have the same effect for women as well.
Yes. In terms of men have increased over 15% in the last 6 years, from about 6% to about 18% now of all facial cosmetic procedures.
Wow. So it's really, it's growing rather rapidly.
It is.
Let me ask you a little bit about just what your Advanced Cosmetic Surgery Center consists of, because there's quite a bit there.
Yes, I am the medical director. I specialize in facial plastic surgery, and those are facial, surgical and non-surgical procedures of the face and neck. We also have a variety of skin care services that are offered through estheticians who provide skin services. We also have cosmetic dermatology and cosmetic dental services offered at our center.
So it really is kind of a complete center. Let me ask you about specifically, you are a facial plastic surgeon. You really specialize in that arena alone, right?
That is correct, yes.
And why did you decide to do that? Because so many plastic surgeons that we talk to these days, they do everything.
Yeah, my training has been in facial surgery since my first residency, and I elected to specialize in that area just as a podiatrist or an orthopedist who specializes in the foot might choose that portion of the body. This is all I do, and this is what we do every day.
And when you say this is what you do, what are some of the various procedures that you perform?
A whole variety of surgical procedures, including facelifts, eyelid procedures, nasal procedures, anything that really pertains to the face and neck area.
Is it all cosmetic, or is some of it reconstructive?
The majority of my practice in Cincinnati is cosmetic, although I am involved with a program called Face to Face International, where we travel abroad to provide reconstructive services to children with craniofacial deformities.
I know another thing you do, which I would assume is very, very helpful to your patient. You have a program that you really set out to educate the patients about the procedures that are available. And how do you do that?
We do. We think that education is a vital part of making a decision and moving forward with these types of procedures. We have weekly seminars, hour-and-a-half long seminars, where we choose different topics, and we review them in quite extensively with patients.
And is one of the big decisions that they go through is whether to have something that is a surgical procedure or not?
It may be. They'd like to know what their options are, certainly, and from there they may elect to do a non-surgical or a surgical procedure.
So what is the difference? What would be the difference between a procedure that really is surgery, where you're invading the body, versus a non-surgical?
For example, let's say somebody is complaining about lines around their lips or lines in their forehead. Non-surgical procedures may consist of things like Botox treatments or non-invasive laser treatments, where we're able to build collagen with no downtime and in a non-invasive manner, versus a surgical procedure such as a brow or forehead lifting procedure may accomplish the same thing, but in a surgical manner.
You know, I want to point out that you are double board certified. How important is that?
I think from a patient perspective that is extremely important. If one was choosing a cosmetic surgeon, you would certainly want to make sure that they were doing large numbers of surgeries in the particular area that you were interested in.
So what does it really mean? Explain to me what double board certified means.
My first board certification is in head and neck surgery and otolaryngology, and what that is a specialty that upon completion after a 5-year residency, you become, you can call yourself a facial plastic surgeon. However, I elected to follow that training with further fellowship training through the American Academy of Facial, Plastic, and Reconstructive Surgery, and then became double board certified by the American Board of Facial, Plastic, and Reconstructive Surgery. So unlike other plastic surgeons, I've always specialized just in the face area.
And what about the technologies that are involved in what you do? I know there have been a lot of new techniques that have resulted from technology. What are some of them?
One of the most exciting advances has been the use of autologous platelet gel.
That's a tough word.
That is a tough word.
I've worked on that myself. I'm glad you said it.
Yes. Autologous is a word. It means it comes from you, and what comes from you is some of your own blood. So for example, if you were coming in for a lower facelifting procedure, what we may do is we would take about 45 cc's of your blood, we would spin it down in a centrifuge for about 12 minutes, and it would separate your blood into 2 different components. One of those components is something we call platelet-rich plasma, or PRP. And platelets are blood cells. Platelets are one of the first cells to come to the area to help stop the bleeding. What they also contain are very powerful wound healing factors. So, for example, if your skin is here and your muscles here, and we're spraying this platelet gel between the 2 layers, it is actually stimulating the healing process. So, in other words, we don't use tubes or drains and large dressings. We see markedly reduced bruising and swelling and overall faster recovery. This is something that's been used for many different specialties, including cardiovascular. Many oral surgeons and periodontists use it for other procedures, as well as spinal surgeons.
And is this kind of something that it's more unique to your practice than others? Because this is really the first time I've heard that in connection with facial plastic surgery.
Yeah, platelet gel in some capacity has been around for over 15 years, but in our region we are the only plastic surgery center currently that offers this service to our patients.
And what's the really big benefit of it?
The really big benefit is really getting back to your life sooner. The faster recovery, safer recovery, more natural recovery, yes.
Well, it sounds like it's a very, very complete facility that you have, and obviously with your background, it would seem to me that it would put patients very much at ease, because obviously you've been around and you know what you're talking about.
Well, we hope so. Thank you.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it is my pleasure to present our Keeping America Strong Award to Dr. Jon Mendelsohn, the Medical Director of the Advanced Cosmetic Surgery and Laser Center of Cincinnati, for the outstanding work that he is doing to help keep Americans looking healthy and strong. Dr. Mendelsohn, congratulations and continued good luck.
Thank you, Doc.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
Our thanks to retired Rear Admiral Kevin Delaney for taking part in the presentation of the Keeping America Strong Award, the award that salutes small to middle-sized organizations who are helping to move America forward.
For more information about Dr. Mendelsohn's Advanced Cosmetic Surgery and Laser Center, you're invited to visit their website at www.351face.com.
That's it for Heartbeat of America's special edition, Keeping America Strong.
Now for a final word from William Shatner.
Well, that's it for this edition of Heartbeat of America. I'm William Shatner. Thanks for watching.